Hi, my name is Emmanuel Cruz Carrasco. I'm going to read chapter 33 of the textbook Professional English Use in Medicine. Chapter 33 is the urinary system. A. Urinary symptoms. Urine is formed in the kidneys and stored in the bladder until it is passed or voided. Patients may say, I have some pain when I pass water. I have some pain when I pee. Doctors may say, are you having any trouble with your waterworks? Doctor, are you having any trouble with your waterworks? Mr. Jones, well, I do seem to have to go to the toilet more often than I used to. Doctor, how often is that? Mr. Jones, it depends, but sometimes it's every hour or even more often. Doctor, what about at night? Do you have to get up at night? Mr. Jones, yes, nearly always 2 or 3 times. Doctor, do you get any burning or pain when you pass water? Mr. Jones, no, not usually. Doctor, do you have any trouble getting started? Mr. Jones, no. Doctor, is the stream normal? I mean, is there still a good, strong flow? Mr. Jones, perhaps not quite so good as it used to be. Doctor, do you ever lose control of your bladder? Any leaking or dribbling? Mr. Jones, well, perhaps a little dribbling from time to time. Doctor, have you ever passed blood in the urine? Mr. Jones, no, never. Common urinary symptoms and their definitions. Frequency, frequent passing of urine. Dysuria, burning or scalding pain in the urethra when passing urine. Nocturia, urination at night. Urgency, urgent need to pass urine. Hesitancy, difficulty starting to pass urine. Urinary incontinence, involuntary passing of urine. Hematuria, macroscopic blood in the urine. P. Urinalysis. Urinalysis is the analysis of urine. Simple screening tests of the urine are carried out with reagent strips, for example, Clinitrix for the detection of glucose. More detailed tests are carried out in a laboratory on a specimen of urine. Typical specimens are a midstream specimen, MSU, and a catheter specimen, CSU. Microscopic examination may reveal the presence of red blood cells, pus cells, or casts. Casts are solid bodies formed by protein or cells. Plus signs are used in case notes to indicate abnormal findings. A small amount plus is described as a trace. For a large amount, plus, the words gross or mark can be used. For example, gross hematuria. Where there is nothing, the word nil is common. Here we have an illustration. Sorry for the video being mirrored. And here we have the sugar is nil in the notes. The protein is a trace, and the blood is gross or mark. Now, in a sentence, this will be, there was no sugar, a trace of protein, and gross hematuria. Now I'm going to read the exercises of chapter 33, the urinary system. 33.1. Look at the conversation in A opposite and complete the notes about Mr. Jones. Use medical terms where possible. Case notes, urgency and nocturia for 1 year. No dysuria or hematuria. Flow a little weaker. No incontinence apart from occasional dribbling. 33.2. Match the patient's descriptions of their symptoms 1 through 7 with the medical terms A through G. Look at A opposite to help you. Now I'm going to make the matches. 1. I have to pee every half hour or so. This is 1 and B, this is frequency. I had to pee every half hour or so is frequency. 2. I get a scalding pain when I pass water. This is A, dysuria. 3. I have to get up several times to pass water at night. This is E, nocturia. 4. I have to rush to go to the toilet. This is F, urgency. I had trouble getting started. This is D, hesitancy. 6. I can't hold my water. This is G, incontinence. 7. I pass some blood in my urine. This is C, hematuria. 33.3. Write the doctor's questions for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own question for urgency. Now here are the questions that I made according to the symptoms that the patient said. Here are my notes. Sorry for there being mirror in the video. Okay, I'm going to begin. 1. How many times do you have to pee? According to the symptom, the question is to know if there is frequency. 2. Does it hurt when you pass water? This question is to know if there is dysuria. 3. Do you pee more in the daytime or at night? This question is to know if there is nocturia. 4. How intense you need to pee? This question is to know is there urgency. 5. Is it difficult for you to start peeing? This question is to know is there hesitancy. 6. Is it hard for you to control your waterworks? This one is to know is there incontinence. 7. Have you noticed any blood in your urine? This one is to know is there hematuria. Okay, so now I'm going to read 33.4. Describe the findings of the laboratory report in words. Look at the opposite to help you. Here are the laboratory reports. Sorry for the text being mirrored in the video. Here we have blood is a trace. There is gross or marked protein. And there is nail cast. Now in words, this will be there was a trace of blood, gross protein, and no cast. So that was chapter 33, the urinary system. Thank you very much for your attention and for watching this video. That was the video.